Hello and welcome to the Core 4 Momentum podcast. My name is Jessica Thompson. I'm a doctor of physical therapy interested in pelvic health. Today, I have the honor of interviewing one of our Core 4 Momentum tribe ladies. Her name is Jennifer, and she's going to share her birth story with us. So, I'm just going to let Jennifer introduce herself, how old she is, where she's from, and what she does. So go for it, Jennifer.
Thanks for having me. I'm Jennifer Becker, and I'm from Elizabethville, Pennsylvania, not far from where Julia um, grew up in Lime Mountain. One of the questions you have on here is how I've been with Core Momentum. I know Julia from track in high school, and I saw her posting, run. She was early in her pelvic therapy training. I joined it then, the group, and since then, but I'm from really close to where she was, and my family is all back there in Pennsylvania. I currently live in Virginia, so my husband being active duty Navy. So yeah, all of our family is there. But what I do, I'm also in the reserves, Navy reserves. But what I do in the reserves, I also do my civilian career is intelligence, so intelligence analyst. So it's a little bit about me and what I do. So yeah.
Oh, cool. Well, thank you so much to you and your husband for serving our country. It
Mhm.
means a lot, especially during these times, during all times. So thank you so much for that. So it said you knew Julia. She kind of started Core for Momentum. So
Mhm.
that's cool that you knew. So you guys went to high school together?
She went to Lime Mountain, I went to Upper Dauphin, but Lime Mountain came to our school for track, so I met her track.
Oh,
So
cool.
yeah,
Humble beginnings. I love it. Okay,
yeah.
so Jennifer, how old are you?
I'm 27.
Okay, all righty. Um, when reason why we chose you to do this interview is because you had a home birthing experience. And for our listeners today, just quick background. So we're talking about planned home birth, correct? So this is
Correct.
planned. Okay, so we're talking about planned home birth and just in general, you don't have to have delivered in a hospital. You can have out of hospital birth. So either it can be a home birth, a planned home birth, or a birthing center. We're talking about home births today. In general, in the US, most of our births are in hospital settings. So about 1 out of 62 births in the US are home births. So that's about like 1.6% out of all the births in the US.
Mhm.
So it's a very small amount,
Yeah.
but recently it has increased. So in 2004, these are stats from the National Institute of Health. In 2004, about 35,000 births were at out of hospital births in the U.S., and now it's doubled almost. It's
Mhm.
62,000. As of 2017, those were the latest numbers. So I'm sure now there's even more. So Jennifer, why did you choose a home birth?
So my home birth was my third birth. So I have three daughters. My oldest is 4, my middle is 2.5, and my youngest is 1.5. She was not a planned pregnancy. I was only 7 months postpartum with my second when I got pregnant with her. So I was like, oh my goodness, am I ready to go through this again? I just went through it. So um, I had 2 hospital births, and I was just over 20 weeks, right on 20 weeks with my third, and I was with the same provider for all of them. And I was at a total care for women health facility. So, they did everything women. And it was awesome. And one of the providers there, she was a midwife, a certified nurse midwife,
Mhm.
and she was moving. And I loved her the most out of all the providers there. And I just kind of talked to my husband and I said, you know what? Well, it wasn't guaranteed that she would deliver my third baby anyways. And I just, I talked to him. I said, had unmedicated births in the hospital. I know I can do it without that. So I just want to see what my options are for an alternative birth. So our insurance TRICARE only they don't cover everything. Most insurances don't cover home births or midwives or anything like that. However, I think it's worth every penny, and I'm gonna get to that later, but I think it's worth every penny. And I looked into it, and TRICARE will only they will cover some of it to kind of reimburse you for some things,
Mhm.
but only if you use a certified nurse midwife.
Okay.
In the Virginia area that I'm in, Hampton Roads, there's only one. So
Wow.
when I was deciding this at 20 weeks, I was like, there's no way she's going to be ready for me in 20 weeks. Like, I'm in a huge military area. But I just started by joining, I'm sure almost every local area has a home birth thing on Facebook, a group. So I joined that and just put the question, and I got in contact with her. And at 20 weeks, I transferred care to her. So that was how I found her, and kind of why I chose. So yeah, so that's why I chose home birth,
Okay.
and I'm very happy I did.
So cool. You mentioned a lot of things that I wanted to touch on. So that's great. One of them being insurance and having to pay to have a home birth. So going back to those numbers, and one of the main reasons why the number is so low for out of hospital births in the US is because most insurance providers don't cover home births. And if they do, they cover only a portion. So a
Yep.
majority of home births are paid out of pocket. And so you can just think about the amount of women who are kind of like, who don't have the option to pay to have their babies out of pocket. So it's hard for them to make that decision because they don't have the means to. So
Mhm.
I'm so glad that you were able to do that for yourself and to make that choice. But that is something to keep in mind. Also, you mentioned that your midwife was a certified nurse midwife. And for all the ladies who are listening, it's important to, if you're looking to do a home birth or you want a midwife to be involved in your birthing journey, to make sure you look at their credentials, to make sure either they're a certified nurse midwife or a certified midwife, or if they're just simply a midwife, make sure they have the licensing that they are supposed to have by the certified, the Confederation of Midwives Global Standards is what you want to make sure that your midwife
Mhm.
has to make sure that you're getting the care that you need, the quality of care that you need. But
Correct.
it's interesting that you had two hospital births at first, and then the
Mhm.
third. So one of your main reasons why you chose to do a home birth for the third baby is because you just formed this connection with the midwife that you had in the hospital.
Correct. I My first two deliveries were my first one was with one of the providers that I had at the care that I had, because the center that I was at, or the doctor's office I was at, was right across from where the hospital was. So if you went during the day, if you had, went to labor during the day, most times the on-call doctor was at work and they would just pop over to the hospital, right?
Mm-hmm.
But for my second, I had her in the middle of the night. I don't know the doctor that delivered my baby. It was just the on-call doctor of the hospital. So for me, when I was reaching out to the midwife, what I didn't understand was it's not a doctor's office. It's her practice. And when I started having my appointments with her, I was used to just coming in, having a few, they check the baby's heartbeat, say, hey, do you have any questions? Nope, cool, good, on your way. 5, 10, 15-minute appointments. She, she booked an hour of her time. And whether you use that whole hour or not, it was yours. Yeah,
Mm-hmm.
because I asked her the one day, I was like, you know, I don't I don't need to be here as long as we are. Like, and there's nothing wrong with my pregnancy. I'm, you know, I would stay here if I need to. I said, but like, I don't have to. She's like, I book an hour of my time for you if that's what you feel you need. So that was number one, completely different experience. And I think is important for women who aren't experienced in pregnancy, labor, and delivery to have somebody who books that time for you. And they're there. They're the one person you see every appointment you go to. And they're going to be the ones there in your home or in your choice of place that you choose to deliver in. If you choose a birthing center, like you said. So that was huge for me. I was like, I was used to that. So yeah, it's
Wow,
different.
that's so good. And that's one of the reasons why I chose to go into physical therapy, because we get to spend so much time with our patients. Usually we see our patients for like 45 minutes to an hour doing what I do. And you can really form a bond with patients, and you have more time to listen to the patients and their needs when it's not just like a 10-15 minute pop in, pop out. And I feel like the patient feels more comfortable with you, and you get to build that rapport. And I
Mhm.
know that that's even more important if you're bringing life into the world. You want to build rapport with the person that's helping you do that. So I'm glad she
Right.
was able to, take out an hour of her time with business with you. So you kind of started this process with her 20 weeks in. How often did you see her before you actually delivered?
So the same standard up until 32, 34 weeks. You're every 4 weeks. So at
Mhm.
that time, I saw her at 24 weeks, and then 28, and then 32. And then some providers like to see you every 2 weeks, starting at 32 or 34. So it just depends on the provider, or you have other complications in your pregnancy or whatever it may be. But standard is every 4 weeks, and then closer every two, and then I think 36 weeks on, 38 weeks on, you're every week. So I've never made it past 39 weeks. I delivered 38 5, 38 6, 38 6. So I've never made it past 39 weeks with my babies. So
Okay.
it's yeah. So yeah, that was interesting too. So I was like, all of mine have kind of always been the same. I know people say, oh, all labors are different, all
Mhm.
pregnancies are different. It really hasn't been the case for me.
Oh,
So
wow.
yeah, yeah. So
Yeah, I
my
heard that a lot too.
yeah. I mean,
That-
I've had very, when I say easy pregnancies, I just mean nothing more than some nausea in the beginning. Um, no, no like severe swelling, no just fatigue. Like I don't know. I always say I would love to be a surrogate for somebody because of how easy pregnancy is on my body. But that's way down the road if I ever decided to do that. But I don't know. I've always enjoyed it. So I enjoy the process of everything about it.
Oh my gosh, you are like superwoman. I love it. I love it. And you being willing to be a surrogate, that's so great, because we need more women who are willing to do that. So you go, girl.
Yeah. Um,
Alrighty. So, but besides your certified nurse midwife, what was your team like as far as for the third pregnancy? Like, did you also have other providers that you went to see, or that were providing you care during that time?
she has, at that time, she was in training with her, but her practice was expanding and she needed, help. So she's good to go now on her own. But when I started, she had, um, I started as her midwife in training. She was finishing up hers, but she is now part of her practice and joined. And then they have their home birth assistant. So both providers were typically most times at both of them at the appointment. With COVID though, I know I'm sure like they're one-on-one, so just to consider that right now going on, things have been a little different, I'm sure. But typically they were both at both appointments, and then the home birth assistant. So at 36 weeks, people say, "I can't believe you're having a home birth. What if something goes wrong?" Well, they come to your home or wherever your place of birth would be that you choose to be outside of the hospital. They do a walkthrough, see where it is you plan to labor, make an emergency plan. Where's the nearest hospital? They go over all these things, ensure that the vehicle, if you would need to, has gas, have the emergency contact information. They go over that well before they ever show up for delivery and labor. So those things are taken care of. I mean, so far as to connect to your internet. So when they show up, it's just automatic. They're not asking you the questions while you're contracting, right? So, and that's another thing. When you're in the hospital and you think you're in labor, they haven't even checked you yet to the triage area, the holding area, and you're there. They're asking you questions, and you're having to sign the pin pad, and you're going through these contractions, and you're like, "Can I just get to the room? Like, can I just get this over with?" Right?
And how much are you really
So,
taking in when you're going and people are giving you all this information, asking for your signature, and you can't even really focus or take that in. So I can only
yeah.
imagine how frustrating that must be.
And it's especially when it's the middle of the night and you were woken up to go into labor. It's just another thing added on, that you don't really think about when you get to the hospital. So, and then when you get there, you're in one room, and they have to keep you there to monitor you for about 30 minutes to see if you are contracting enough, if
Hmm.
you are whatever it may be. And for me, my first labor, my husband was gone for just a week. And 2 days into him being gone, my first baby, I thought, I'm gonna be late. I'm gonna come late. This is what they say. I said, I'll hold out till you get back. Well, that's not what happened. So I'm alone. It's 9:30 at night. I'm having what I think is my first contraction, and I call my mom. All my family's in Pennsylvania, 6 hours, 6.5 hours away. I'm like, Mom, I think I just had my first contraction. And she's like, well, call the hospital. So, I call the hospital. I'm like, well, I think I just did. And they're like, well, you can always just come in. I'm like, I hate not knowing. Like, I don't know if I am. I'm alone. So, my grandma's best friend lives about 20 minutes away in Virginia Beach. And my mom called her. We're at like 10:30 at night now. She's like, can you go see her and, take her if she needs to go to the hospital? So we end up going around 12:30. In the meantime, my parents and his parents and sister start the drive down here from Pennsylvania. So I end up getting admitted. Yeah, they drove through the night. They got here, oh, by like 7. So I was in such denial though, because it was my first and he wasn't home. And I was like, this can't be happening. I'm alone. I don't know what's going on. And I'm in the hospital and I'm going through the contractions, and I didn't have nurses that were very like in my face about things. When you do get to the hospital, they do ask you, do you want medication? Do you plan to have an epidural? Because some women are like, give me it. I don't care what it is. As soon as I get there, I want it, right? As soon as you can give it to me, I want it. But for me, I was like, I don't know. I'm okay right now. I think they're coming in waves, but I'm able to breathe through them and deal with them. And I remember the one nurse, she just kept coming in and she's looking at the chart. And what I'm assuming to her shows very strong contractions. She's like, are you sure you don't want nothing? I'm like, no, I don't. Like I'm fine. So when my mom and them get there, because my contractions kind of eased through the night, I was kind of able to rest until they showed up about 6 a.m. And I I was like, Mom, man, I don't think I can do this anymore. She's like, well, let's just see, right? So the nurse comes in and she checks and she's like, you're right there. You're past the point of an epidural. You can't have that. I was like, oh, okay. I guess I'm doing this. And I ended up pushing for an hour and 45 minutes. I was exhausted. And I just attribute that to not knowing, not being educated on what to expect, what to do, what muscles to use. It's a whole different thing. It's not just laying on your back and squeezing baby out. It's not that. So for me, I think that was just I just didn't know.
Yeah.
So that was my first hospital experience. Like I said, it wasn't bad. I know there's been much worse. And then
Mhm.
with my second, I my husband was home, thankfully, and I went in the middle of the night. I woke him up and I said, "Hey, I think it's time to go to the hospital." He shoots up. He's like, "Okay, okay, let's go, let's go." So it's just me and him at that time in the delivery room, and about the same amount of time of delivery, labor, like 7 hours. And I had her like right before 7 a.m., right before a shift change, because the nurse, when I showed up, she's like, "You're gonna have that baby before my shift's over." I was like, "Well, when's your shift's over?" She's like, 7:62. But the doctor, when he came in, so my husband wasn't there for the first birth, so he's expecting like a rush of nurses and all of these things, and it's just one nurse. And the doctor comes in, I don't know him, and he kind of looks and he's like, "Okay, I'm gonna break your water because as soon as I do that, the baby's coming." I was like, "Are you sure?" Because I pushed for an hour and 45 minutes for the first one. So he does that and he leaves the room. And my husband's like, "Why is he leaving?" I'm like, "Well, he's up." He showed up in his like brown sweater and loafers. I mean, he's not even like, anyways. So I was determined to not have an epidural that time as well because I knew it just the first time. And I wanted my husband to see it. It was kind of like I want you to see that I am strong and I can do this. Not that he put that pressure on me at all. Because I did tell him when it got to the point, I was like, "I don't know if I can do this. Like, I think I need an epidural." And when the nurse came in, they do say, "You mentioned when you got here that you didn't want one. So I am going to check you to see where you are, see how far you've progressed, to see if you can still get one." So she checks me. She says, "Well, you are past the point. As soon as your water breaks, that baby's coming. And also the OR is backed up, so you wouldn't be able to get one anyways." So that right there, you just had a total mind change, a total shift. I'm like, "All right, well, I'm doing it this time too." So when the doctor came in and broke my water, I immediately felt her get into position. And that was like, whew, she's there, baby's coming. And like I said, my husband was not really sure what was to expect. But he's right next to me doing a great job. And I'm I pushed like 5 times, I think. And I guess let out a scream at one point, and the doctor told me to calm down. And I was like, okay, looking back now,
Mhm.
I was like, huh. And relating that to my experience at home birth, that's what I'll compare to in a minute.
Mhm.
And baby's out, everything's fine, and we're good to go. So then come my home birth, I had all of these things in my head, what I learned from each birth the first time in the hospital. When I was pushing with my first, I remember the nurse kind of using her fingers and guiding and saying, push here, use these muscles, bear down here. I did have that in my head. So that is something that I learned in the hospital with my first. With my second, it was, okay, well, I need to remain calm because I don't, it's kind of like I don't want to set those in the room that are helping me, but like it probably wasn't helping myself by not focusing on what was happening, but letting the letting the emotions out in a way that wasn't progressing the contraction or the push or whatever it may be. So while looking back, I'm like, I probably shouldn't have talked to me that way. Um, I can reflect on that in a different way.
Mhm.
But at home, my midwife, I woke up about 5:30 with my first contractions, and I waited a little bit, and I woke my husband up. I said, hey, I think we need to get the girls to daycare because the baby's coming today. It's going to happen. So we get up. That time, it was like 15 minutes to daycare. And we go to daycare. I didn't have any newborn diapers. Like, we got to stop at Walmart on the way home and get newborn diapers. And so we stop, and they're picking up a little bit. And he's like, you need to go. We're not having this baby in Walmart. I was like, okay, I'm coming.
Paul,
So
I just want to highlight how you're still thinking like a mom, even in that moment. Like, we gotta take these girls to daycare. I gotta get diapers for this one that's coming. I love it.
yeah, yeah. No, it is. It is. It's just one of those things. It's once you're a mom, it's what needs to happen to make the day go. Like, and that's that. So we get home, and I'm calm now. Like, I know what is happening with my body, but I'm also still like, I don't want them to come too early and kind of waste their time being here when that is not the mindset you should have. They're they're gonna come when you say please come. Your midwives. They're on call for you after 36 weeks. And the minute you say I'm ready for you to come, they're coming. And I was nervous because it was right around lunchtime, and we're getting to be lunchtime. So if I had waited any longer, I was like, they're gonna get stuck in traffic. I live in the middle of like town at that point. They're gonna get stuck in traffic, people going to lunch, whatever it may be. So when I was ready, when I finally was like, okay, I think I'm ready for you to come. I had already gotten my shower. I had a home birth photographer. I straightened my hair. I was doing all that. I was just getting like, awesome, right? I'm not in the hospital in a gown, uncomfortable. I'm in my home. I'm, relaxed. And when I said, hey, I'm ready for you guys to come, um, when she got here, it was her in training one that got here first because she lived a little closer. So when she got here, my husband, was with me, supporting me. I'm on my exercise ball, all that stuff. And she's setting stuff up, but she's studying me. She's seeing where I am without asking me the questions of how I felt or what it may be. A natural pregnancy and delivery and labor, the signs are very similar in labor if everything's going right. And I learned that. And she was checking the baby's heartbeat with the Doppler at one point. I was sitting on the exercise ball. And she's like, do you feel like this at this point? Do you feel like there's like a bowling ball down there? I said, yeah. She goes, okay, Dad, we're going to start filling up the tub. So just different cues off my body language. She was able to really figure out how close we were. And one tip I would say, if you did choose to do a home birth, my midwife asked me, she said, is this the point that you would feel you would go to the hospital? 100%.
Okay.
So if at that point you feel like, you know what, we would be in the car on the way, tell them to come. So that to me was ensuring too. I was like, okay. Because like I said, I didn't want them to come and waste time, but just don't have that mindset. If you want them here and they're here, they're here, for you. And I was like, when she was setting stuff up, I was like, can you go make sure downstairs? My husband, I was like, that, like the coffee cups are out and all that stuff. And she's like, we are here for you. You're not catering to us. I was like, I can't help it. Like, you guys are in my home. Like, I don't know. It was just one of those things. They're like, just don't think like that, please. It's okay. So they showed up around 9:30, about 10:15. The photographer showed up shortly after that. And they were only there for about an hour and a half before she was born.
Wow.
So, and because I was an experienced labor and they knew that, and they knew, like, I kind of knew what to expect, they left me and my husband alone in my room just to do. just to labor in peace and quiet. I had my little relaxing sounds going. I had some relaxing oils going, all that stuff. And it was an amazing experience. They knew when to come based on the sounds that I was making. And they knew when to come up and when it was time for me to get in the tub and all that stuff. So some of these questions I'll answer a little more, but I don't know if you have anything off of everything I just unloaded. But yeah, I'll pause for a second and see if you have any interjections.
Okay, no, I love the fact because you answered a lot of my questions within that question because in my mind, I wanted to kind of visualize how it was and to know that you were able to prepare your home how you wanted to so you could be comfortable. The fact that you and your partner were able to have intimate moments in birth without a lot of interruptions unless they were needed, but you had the help there so you felt safe to and comfortable enough to do that. I mean, that sounds like a dream. It sounds very beautiful. And I know that's like a bonding experience between you and him that you'll share for a lifetime.
Mm-hmm.
That's awesome.
Yeah.
Um, I have so many questions. So let
Oh,
me.
I will talk till I'm blue in the face. I have so many comparisons on and because I was in the hospital and at home, but I do encourage first time moms. It was one of my first questions to my midwife was, "Do you have first time moms?" She's like, "We do." And I said, "Well, how do they do that?" And she's like, during labor and all stuff, they're just like, "This is crazy. How am I doing this?" And it's just a different atmosphere, and you're encouraged to know that what your body is going through is natural, to take it head on and know that you can do it, and know that they are trained specifically to know if there is a moment where something's going wrong.
Mhm.
When do I call when this is out of my scope of practice? They know that. And that was also reassuring. I'm doing what I need to do, knowing that they're watching me and observing me. If something's going to go wrong, they're going to make that call. That was reassuring. That you froze for a minute.
Oh, so
So
did you. I was like, is she still there? Okay. Little internet mishap. That's okay. You said a lot of good things that I also wanted to highlight about just being prepared for like having your plan A, plan B, plan C, like if things go wrong. And because I think a lot of women do have feel safer in a hospital setting because everything is there, like around the corner. So you just feel safe. But to know that weeks before you plan, what hospital you would want to go to if something went wrong, a doctor that you would see, she was asking you if you had gas in your car, like all the things just to make sure that things go smoothly, whatever route that they take. And it also goes back to the fact that you deciding to choose a certified nurse midwife or a certified midwife that has a lot of experience or one that you know and that you trust. It's important to do that because those are the providers that you want to have on your team in case something does go wrong so that you can
yes.
feel safe. So anyone who is listening and deciding if they want to have a midwife on their team of providers, just do your research to make sure you find someone with experience, someone with the certifications and the licensing that you need to know that you're going to get the quality care and the safety that you need to bring your baby into this world. Now,
My my midwife that I had at the Total Care for Women Center, when I told her that I was looking to switch to home birth, she was kind of like, well, who are you looking at? And when I told her name and the name of her practice, she's like, I went to school with her and we almost opened up a practice together. So it is a close knit community that if you aren't connecting with the one that you think you choose. It's like any other profession. You have to vet and you have to make sure that you work together and that you're compatible.
Mhm.
If they don't feel they're compatible or can meet some of the needs you have, they can connect you with somebody that can. Or if they don't, back to the finance part of it, many midwives do payment plans. They work with you because they aren't in it. They're in it obviously for the money for their practice, but they're not in it for the money. They want women to feel safe and empowered when they are going through the process, this life-changing process. So don't let the money factor completely keep you from at least talking to one. They will work with you. And that's kind of the most I could say on that. So, I mean, everyone has their own situations, their own whatever it may be, but don't let the money overpower your possible want to have a safe and in your own environment labor and delivery. So that's
That's a
that.
really good point. I didn't think about that. Where I didn't know that there were payment plan options for some midwives. So that opens up a window to a lot of people who may think that they're not able to go that route. So thank you for highlighting that.
Mm-hmm.
It is midwives are not as common. They're not as populated as other providers, like physicians for birth. So I looked at the U.S. Bureau of Labor in 2018. Statistics show that there are like over 6,000 nurse midwives in the U.S. So that's not that many if you think about how many women have babies. And I'm not
Yeah.
sure if they these are midwives that are employed, and I'm not sure if these stats suggest those who are employed in hospitals and birthing centers and not calculating the ones who are practicing on their own. I'm not sure, but either way, they are hard to come by, and they're even more hard to come by in southeastern states. So, like where I'm from Mississippi. So Mississippi, Alabama, Louisiana, very hard to find a midwife in those states, but they're more common in the Pacific Northwest. And the three states that had the highest population of midwives who were working were California, New York, and Georgia, actually, which I thought was weird because it's in the Southeast, but hey, Georgia's on top of things.
You did have on, I think, episode 4, I remember, the dietitian doula individual. She mentions the doula service. So while they're not the medical side and couldn't do the things that a midwife can do, if you don't have at least that option, you can have a doula on your side in birth, and that is also an added bonus to have.
Mm-hmm.
I actually want to become a doula eventually. My kids are a baby right now, so my home birth kind of opened up a whole new world to me. Labor, pregnancy, delivery, all of that. It kind of just shifted my mindset to wow. And when I talk to people about having a home birth, they're just kind of like, oh, I can't believe you did that. Because in modern medicine, there's hospitals. Why would you want to do that at home? If you've never delivered in a hospital, you don't know that, you don't understand that that provider, that doctor comes in just to catch your baby. They're not there with you through the whole process. They're not, that's what they do. They stitch you up and they leave because they got to go on to the next one. So that is also what's different, at home. There's no rush to bring in placenta. And for me, I didn't realize that either. My first two. My first one, I was just relieved she was out. I'm like, oh, thank God I'm done pushing. I didn't really realize what happened after that. I had just minor tearing that he needed to stitch up and, whatever. I was just so tired. And then with my second, same, a little bit of stitching, but I could feel him tugging to get the placenta out. Like, let's go, let's go, let's go. And at home with my home birth, I was able to birth in the tub, and which is not always messy. My water was clear the whole time. My husband was in the water with me too, and I found that crazy that my water was clear the whole time. Like, that's just nuts. And anyways, so I didn't my placenta came out naturally on its own. I was in the water for about 5 minutes after she was born, getting her to cry and all that stuff. But she was with me. She wasn't taken from me. And um, I loved having my home birth photographer there because while I can remember the moments with my first two, I have like 100 pictures that I can look back on and see the moments, like you said, the experience, and I can put myself back there. And it wasn't scary. It wasn't tense. It was calm. It was peaceful. Everybody I had there was there for me, and it was amazing. And she got an excellent picture that I love. My husband's behind me in the tub, and she got like an angle looking down, and both of our hands are on her. She's like, she's covered in the white, I think it's called Vernix. And my other two weren't like that. She was so sticky and white, and I was like, I would have never remembered that had I not had these pictures. So um, she was there, but I was in the tub for about 5 minutes, and then um, one of the questions that you had asked is kind of the what is it, the supplies and things like that to prep. So they provide the blow up pool for you, but some things you have to buy your own are like the liner for the tub. They ask that you have your bed ready, made twice, with a sheet and then like a shower curtain or whatever and another sheet. So that way, if you are in your bed and you have a mess, they just strip that down. Your bed's still made and you're good to go. But came out of the water and I was on my bed, and my nurse and my midwife, she's just waiting for my placenta to come out on its own. And I'm like, this is just crazy. I was like, this was like forced onto me in the hospital, which can cause unnecessary bleeding if they don't get all of it out, infections. I remember him counting my second birth. He was counting. I'm like, why is he like, why is it coming out in parts? Like, isn't it like one thing? So when it happened at home and I, got on the bed, it was like maybe 5 minutes later, and the cord wasn't cut right away. I was able to what they call it, delayed cord clamping. Baby gets that last bit of blood out of the placenta, um, which some people, I guess, the placenta can go very long. Mine was pretty quick. It almost by the time I had birthed it, it was gone. It was done. Um, but my midwife. So when you think of my team and you think of a homework team, I had one midwife, the main one. She was kind of like more serious and whatever. My second one, she's kind of like, I want to teach you everything because this is so cool, and like the anatomy and all of this. She's just like out there. And the home birth assistant, she had like the head covers and the long skirts, kind of like hippie looking. So it was like, if you think of a home birth team, like it was the trifecta of what you would want, perfect balance all around. So she brings me my placenta over and she's like, do you want to look at it? She's like, are you cool with that? I'm like, yeah. So she showed me the anatomy of it, where the baby was and everything. I'm like, I would have never got that in the hospital. So I learned so much through home birth that I just never knew through hospital. So like I said, there are some supplies and stuff you buy, but it's not much. It's like maybe $200 at the end of like overtime of everything. Um, but yeah, I loved it. It was awesome, all of it.
Wow. The whole placenta education part, like that's like icing on the cake for you to
Yeah.
because I know a lot of women who've had multiple deliveries in the hospital, and they still don't know much about their bodies or the experiences that they went through. But the fact that you were able to have your last birth at home, you had your team, and they were able to take the time to educate you on things, and to allow you to birth the way that you're comfortable, because they were in your home and only attending to you versus in other methods of delivery, you have a provider or multiple providers, but they may also be tending to other patients, on that floor or on other floors. So they're juggling more, but with this time, with you having a midwife and being at home, it was centered on you, as it should be.
Yeah.
So, yeah.
I mean, and they're there until probably like an hour or two after, once they get the accurate measures on the baby that they need, the right temperatures, all that stuff. But nothing is rushed.
Mm-hmm.
Nothing is, I don't, it was just one when I talked about the doctor telling me I needed to calm down. When I got into the water, um, my contractions kind of stopped, or the uncomfortable association with the contractions like subsided. And what I learned earlier this year, I had gone through a childbirth education class. It was 6 weeks, based on the Bradley method, and it's a natural way of laboring. And I I put education to what I experienced, and that leading back to most labors, if everything is going smoothly, have stages, 3 stages. And when I think back now, when I got into the water, before you push and before full transition happens, there is a calm period. There is you get your last, power up, I guess you could say. It's calm. And when I got into the water, everything went away. And I love looking at the pictures about it because I just had peace over my face and I was just focused on it. My water didn't break and with all 3 of them until right before I pushed. But what I did was learned what I learned from my first birth, what the nurse did with her fingers. I did that myself. I was feeling down there. I was feeling where she was, where to push, what would be helpful. If I pushed a certain way, how far did that bring her down? I felt all of that. I was in control 100%. My midwives were right there. And if I was like, hey, I can't do this, they would have stepped in. But they were right there. And when my water broke, I knew what was going to come right afterwards. I knew it wasn't peaceful anymore after that. So my husband's in the water behind me, and I asked him, I was like, "Hey, do you want to feel this?" Like, because I'm talking, I'm chatting, I'm relaxed. I'm like, "Hey, do you want to feel this?" He's like, "It's okay," because my water hadn't broke yet, and it's just like this. It's like a thick balloon. Like that's really what it feels like. And I was able to feel that, and I'm like, "Hey, do you want to feel this?" Like, that's all right. But when my water broke, I felt his energy. I felt him tense up because he also knew what was going to come right after that. And I remember one of my contractions had ended, but I was still trying to push. And my midwife, so it wasn't being effective at that point. She said, "Is your contraction over?" In a calm voice. I said, "Yes." She's like, "Stop pushing, let the next one come." Unlike, "Hey, calm down," you know, like it was just so different. She realized that I wasn't being effective and calmly told me regroup, not calm down. So that is another thing I I took to heart. I was like, man, that is it's so different. Everything's just so much better. And also in the hospital, as soon as you get there, you are hooked up to the monitors, 2 on your belly, one for you and one for baby, because the nurses aren't there the whole time. They need to they have their monitoring station, and they have this is for women who've never given birth. Um, they have their screen out at their station of all the babies that they're tracking, all their heartbeats. And if they lose that heartbeat or if something seems off, they're coming in and checking where that's placed. Is the baby moving? What's going on? Signs of distress are signaling of that. I'm all belly when I'm pregnant.
Mm.
I'm more focused on keeping that monitor like pushed in on my belly in any position that I'm in. So they're not constantly coming in and be like, hey, can you fix that? At home, whatever position you want to be in, your hands and knees, your side, your back. Some women like to sit on the toilet. I mean, just all these different options that you have that you definitely have at home. However, you are comfortable, they have their Doppler and they are underneath you where, or, you're standing there, right next to you. They are meeting whatever makes you comfortable. And whether you need an IV or not when you get to the hospital, you're stuck with that. That's not at home unless you have, if you need right after birth or when you're in labor. I forget what the term is, but they certified nurse midwives are able to give you an IV and they can give you the medicine that you would need while you're in labor if that's the case, and you would have an IV at home. But if
Mhm.
you don't have that, I can't remember what it is. Then you don't need that. So at home, you are not hooked up to anything. You are free to move about and do what you feel comfortable and natural to do. So that was
That
also a huge change.
I swear you keep reading my mind because I was gonna ask you about changing positions and stuff. So that's so cool. And I didn't. I was just thinking about me personally. I wouldn't want to be like on my hands and knees in a hospital just for sanitary reasons. But also, like you were saying, the all the monitors and things that you have hooked on that does kind of limit, how you can move. I didn't even think about that, but I'm glad that you were able to move around as you felt natural to do so when you were at home. You mentioned earlier about with your first baby how you toured just a little bit, and one of the benefits of home births is that it's statistically those vaginal tears, especially the more severe ones like the grade 3 grade 4 tears, are less common
Mm-hmm.
in those home births. And you also talked about with the placenta how if a little bit is left in, it can increase the mother's risk for infections, and maternal infection rates are also lower for home births compared to hospital births as well. And then, like you said, the IVs and just the other interventions and other, different types of medicines and, surgical incisions are a lot less for home births as well. So the mother doesn't have to go through all of that. So those are some benefits that you talked about. I just wanted to highlight towards the end here some benefits of home births. Besides that one-on-one care that we all need, honestly, and deserve. And that's not to downplay hospitals because they are needed as
It's not.
well.
They are.
And of course, a nurse and staff have to tend to other patients. It's just the name of the game and how it goes, and that's understood. But if you have the opportunity to have one-on-one care, why not? And to have it in your home, why not? Because there are also benefits and there are also risks of home births. And as a mother or a woman who is listening to this, it is up to you to be your own advocate and decide what's best for you. But don't just believe that you have to have your baby in a hospital because that's how it's normally done. Do your
Mhm.
research on all the other avenues that you can take to deliver your baby, especially in the times that we are in now with COVID-19 and not being able to have family in the hospital with you. If a home birth would be a great option to still have your family and your loved ones around you during that time so that you won't have to be alone or people that you care about won't have to miss out on that experience with you. And Jennifer also gracefully highlighted that even if she's a mother of three and she decides to do it on her third birth, but even if you're a mother of your first time mom, a home birth is still a good option because you get so much education and so many resources that you can feel safe and confident enough to do it at home. Jennifer, do you have any more advice, words of wisdom for women who are listening or watching this episode regarding home births and the decision to do or not to do?
I would say do your research on any option you choose, whether it be a group of providers, whether it be a single nurse midwife, whatever it may be. Just do your research and understand that you do have options, and don't think of pregnancy and labor and delivery as the scary, screaming, crazy event that you see in movies. Because when I share my story with women who have never, or, they plan to eventually have children, I can see in their face they're tense about it. But when you educate them, they're like, I had no idea.
Mm-hmm.
And women, we, as our bodies are amazing in so many ways, and we just don't even, unless you ask the questions like, what's going on with my body, nobody's gonna be like, hey, you should expect this to happen when you turn this age, or when you get pregnant you should expect these things. And when you go to providers, like, well, what questions do you have? It's like, I don't know what questions to have. Talk to me and I'll tell you if I understand or if I know that already. But
Mm-hmm.
most times women don't. We with the education is just not there, so they're scared, they're nervous, they're tense. But just understand that, find the right provider that's willing to dive deep if you say, I have no questions. Like, ensure that you don't have any questions, and they just kind of push you to understand what to expect. One other tidbit I didn't really get to mention, I learned this through my home birth, through my midwives, is cervical checks and ultrasounds, and ones that are unnecessary. So you will typically have about 2 ultrasounds in a normal pregnancy. The first one to ensure, your first appointment between 6 to 9 weeks, and then one around 18 to 20 weeks, and they call the ear anatomy scan, not just to find gender, but that's when they're able to ensure that all organs are growing properly, nothing's missing, whatever it may be. And those should be the only two you have, unless they find something in that 20 weeks. And then cervical checks. I did not have a single cervical check with my midwives, not one. And I asked them a couple times, like, hey, could you check me? They're like, there's no need. I'm like, well, what do you mean there's no need? My first two, I was checked every appointment. And what I learned was cervical checks increase risk for infection, but they also have no indication or show no signs of how far you truly are in dilation or how close you are to labor or anything. My first daughter, I remember I had an older physician at that time, and when she had checked me, I think it was my 38-week appointment, because I had her a few days later. She was very invasive with it. And she told me, she's like, I was just very invasive. You'll probably have spotting for a few days and all of this. And it was very uncomfortable, but I was like, okay. She's like, you're about 2 centimeters, you can go really anytime. I'm like, okay. And I had her a few days later. I think, maybe had she not done that, I would have maybe gone a little longer. I mean, I was fine to go when I did,
Mm-hmm.
but and then with my second, I just thought that was normal. They check me every time. Check baby's heartbeat, check your cervix, and what that entails is them, using their fingers and just feeling there, and it's unnecessary, and you can decline it, and just to know that. And I thought it was normal for my second, and I asked, there's a method to potentially bring on induced labor. It's called sweeping your membranes. So what they'll do is they'll go in and they'll just kind of like sweep around, kind of separate the placenta from the cervix and the membranes that are there. And if that's going to take effect, that'll be 24 to 48 hours that labor could start. And I had asked that had been done for me at my 38-week appointment with my second one. So like, oh, it's normal, it's fine, baby's fine, I'm fine, we could do this. That was more for, I knew my husband was going to be home, and I was hoping I didn't have to go alone again. So that was kind of me being selfish on my part, but my provider also could have said, hey, that's not necessary, because through all of those pregnancies, my husband was attached to a boat, so he was in and out all the time. So when I planned to do a home birth, there was potential that he would be gone again. And I was asking my midwife, I said, is there anything we could do? Like, I want I want him to be home when this baby comes. Like, I don't want to do this alone. And she thankfully was like, I'm not going to do that. That is something I told you from the beginning. And it was a moment of emotional response for me on him may not being here. And I needed her at that time to just say, look, it's going to happen when it happens. Me checking you means nothing. That doesn't mean you're going to go tomorrow. It can mean you could walk around 3-4 centimeters for weeks. It doesn't mean anything. So know that they're not, cervical checks are not necessary, and understand if they are going to do them, ask why, and know that you can decline them. So that was another huge learning point for me, that I even when they showed up, for my birth, they didn't come in and invade me. They studied me. When you get to the hospital, the first thing they do is check you. And they say, oh, you're 2 centimeters. We'll hook you up, see how your contractions are for about 30 minutes, and then I'll check you again. Like, you could be checked within your first hour there 2 or 3 times before they determine if you are going to stay or not. And then they're checking you all the time. And it's uncomfortable because you're having those contractions and you don't want something else shoved up there when something else is trying to come out. So I know that it's a practice in the hospital, but it doesn't have to happen. So, because it's no indication at all. So yes, that's kind of what I want. I didn't want to miss that in here for those who have never had a baby, or if they had and they'd be like, I didn't feel like that was right. It probably wasn't right. So yeah.
Wow, thank you for throwing that in, because for every episode we like to mention some type of way where women can learn how to advocate for themselves. So thank you for sharing that, and just for sharing your entire story with us and really educating us on so much. I'm not a mom, but I aspire to be one day. And after listening to you and your story and what you've gone through, I am totally on board to have a home birth. So you have empowered me for sure, but I know that this podcast is going to be viewed and listened by so many, and you're going to empower so many more. So thank you
I
so
hope
much.
so. I hope so. And anyone can reach out to me at any time. I'm in Virginia, but like I said, I eventually want to become a doula. So that's going to involve me networking anyways. So I am all for answering any questions. Like, reach out to me. I don't care.
Yay! Well, Jennifer is a part of our Core for Momentum private Facebook group for women. So if you want to connect with Jennifer, get on our Facebook group. She's on there. And you guys can mingle and talk and share stories within our private Facebook group. It is there. Do you want people to reach out to you in any way, or just find you on Facebook?
I mean, Facebook, I mean, you can put anything in my email in there in the show notes, whatever it may be. I'm willing, like I said, I'm willing. I'll talk to anybody. I just love getting it out there, knowing that so many women aren't educated in it. I'm just like, hey, let me tell you my experience. And it's not everyone's experience. And I don't want it to seem like you have to have that, because it's not.
Yeah.
But that was mine, and it can be done that way, and know that it's possible. So that's all.
Well, thank you. I will be listing your email in our notes for this podcast. So people, if they have questions about home births, they can reach out to you through email. Thank you for being
Okay.
generous enough to offer that.
Thank you for having me.
No problem. This was so fun. I am so excited about this one. Thank you so much.
You're welcome. Bye.